For the next technique, we're going to be focusing on hitting the lower gluteus maximus. If there's a problem that also happens when we end up developing this restriction on this anterior portion of the thighs, or even just on the anterior portions of the psoas, like this muscle behind the organs, when we get those restrictions on the body, when they begin to impede hip extension, sometimes what we end up getting is not hip extension, and we default to going directly into hyperextension, and we create this thing called an anterior pelvic shift. You guys, that's kind of characterized by the hips moving excessively forward ahead of our upper body, creating this hyperextension, this default hyperextension in the hips that then ends up creating a massive restriction right here and this upper hamstring lower glute region. So essentially, if you continually have this restriction present, your hips are going to end up sending you off, or these tissues are going to end up sending your hips off in a forward position, and that's going to keep you into this kind of kypholordotic position. But if we can get into those tissues here to facilitate more length into those lower glute those lower glute upper hamstring fibers, that's going to facilitate an easier posterior pelvic shift. And that idea of creating joint stacking within my body and having a good posture and then having good structural integrity as I walk and as I move in space will be much more capable of that if we have more length on this lower portion of that glute region. So what we're going to do is get on top of this medicine ball here. We're going to place it directly underneath that gluteal fold. We're going to take ourselves into what I would classify as an anterior pelvic tilt. So you'll see right here, what I'm going to do is take the pelvis and tilt it back in this fashion. So this is called an anterior pelvic tilt. Pelvis is going to come back. I'm going to aim to keep this nice and neutral in my lumbar. If I start slumping forward into this position here, what that's going to do is to some degree shorten the fibers of this region of the lower glutes, upper hamstrings, and I'm not going to get in as effectively. But if I begin to kind of anteriorly tilt in this fashion, what that's going to do is create length on those regions, and then from there, enable the ball to kind of get in and then lengthen and hydrate those bands. So from there, I'm just going to be thinking about trying to balance myself. If you have a chair to hold yourself on, I don't really need it myself because I'm kind of balancing on my right leg here and obviously on top of the ball. But if you feel that you need to have some kind of stability, sometimes a chair can be really useful to hold on to here. But in general, the main way to go about this is getting into that anterior tilt. If you really want to push this release a little further, what you'll want to do is kind of almost extend out that leg a little bit, and you might begin to feel a stretch in the hamstring along with this release right here in this gluteal fold region. So what you'll then also want to do is kind of rock back and forth. You don't want to get too far in this direction. Just in general, you're going to have some ligaments that you don't really want to get into. What you'll want to do is get a little bit more down the center. Obviously, don't get too far out to the side either. We already kind of covered that on the last release. Let's try getting somewhere down the center. You'll feel that nice nodule, kind of the similar thing I was explaining about, where you want to put the pressure on top of a release point like this. You'll feel that point, and if you slide off of it, you'll be like, I'm kind of slipping off. But if you get right on that center point, you'll begin to understand much more of what I'm talking about as it relates to pinpointing the spot that you need to when you do this release. So right now you can already see I'm already starting to round more because that's my tendency when I'm in this position. So I have to start telling myself, Nowdy, come on, let's go with that anterior tilt. I could feel the release diminishing. Now the release is back. So just look for almost like a straight lower back, maybe a slight anterior curvature of the lower back as you get into this position. You might be, if you guys start hearing little clicks pop up on the microphone, is because I'm cavitating. It's almost think about like a soda can that's been crinkled up, uncrinkling and whatnot. And if you hear me doing that with on the microphone where you hear like a small pop, that's just what ends up happening. I just had another one there. And when I get into good position, that's what ends up happening to me. If it happens to you, don't worry. It's a normal tendency. Or it's not normal. It's unusual, but it's always unusual for the right reasons. Some of the best athletes that I've worked with have the capacity to create those cavitations just by doing release work. Think about like a micro version of a chiropractic adjustment. Okay, so again, I'm holding that anterior pelvic tilt. I find that spot in the center. I'm really getting a good release now. Like it's really starting to loosen up. We want to make sure that we stick on this, again, for that 2 to 5 minute mark so we get an effective release out of that. We get that fuller release out of those on that posterior chain. So don't skip the steps. Don't shorten this up because it feels maybe a little bit uncomfortable. The point of benefit always comes between that 2 to 5 minute mark, maybe even more, depending on how restrictive you feel in these areas. It's really starting to get in there for me right now, and it feels absolutely amazing. Anyway, let's move on to the next technique.